Kogo News Time 5:13. Tomorrow is Veterans Day, and we celebrate the veterans who have fought for our country. But we're still giving them the short shrift when it comes to dealing with the after effects of war.
Joining us on the Kogo News Live line, Dr. Al Johnson, who treats veterans with PTSD. And Doc, the latest numbers have about 400,000 veterans struggling with PTSD. What are we doing, if anything, to help?
Well, the Veterans Association, it does treat these vets. They're on medication. The Wounded Warriors have programs that help them re-socialize, give them activities to do to help integrate them back into society. But not enough is being done, as the article pointed out, that there's numerous vets that are having trouble. And the PTSD involves, the brain and what how it behaves after traumatic events. And this varies widely in people, from depression to mood changes, anger, outbursts of rage, difficulty in thinking and processing. So that they have trouble functioning in society many times.
So the bigger question, though, Doctor, is why aren't they getting more treatment? They're getting treatment, but why aren't they getting more treatment?
Well, they're trying to figure out how to best treat these people. There's this article in the Wall Street Journal this last weekend where Mr. Fisher out of New York set up a $65 million treatment center in Bethesda to treat the post-traumatic stress people. And even though they've spent this much money, they only treat 250 people a year. So they're still trying to figure out what's the best way to treat these. And the question is how much component is due to the trauma, the experience, versus actually traumatic brain injury, which is where the brain is injured from a blast or direct force to it. So you turn over a vehicle and you bang your head. That's a traumatic injury. Or the bomb goes off and you get a percussive injury to the brain, which causes brain tissue not to work right. And so that's some of the issues that are being dealt with. And it's not easy to define sometimes. I'm working with a study, and we're trying to gather funds for 1,000 vets to treat them with hyperbaric oxygen, which when you provide oxygen under pressure, you get 10 to 15 times the oxygen to the brain, which heals cells that have been damaged. And we're trying to raise funds through the Hyperbaric Medical Foundation to treat these. Currently, the cost is $32,000 vet for medications typically, where a one-time treatment of 80 hours of hyperbaric is $17,000 in this study.
Wow. Well, listen, Dr. Al Johnson, thank you so much for your time. It's, as we approach Veterans Day on Wednesday, we have these vets suffering from PTSD, and finding the right treatment and getting them treatment, even though they are getting some, seems to be difficult.